Ladies and gentlemen, welcome to ActTV. ActTV is a global news channel that provides news on global issues, entertainment news, movies, fashion, style, documentary. Our topic for today is first aid management in our homes and in our public places. Uh, what do you mean by first aid? First aid is the treatment that is given in terms of emergency situations before professional services arrive in order to save life, limit discomfort and complications and injuries, and also to maintain orderliness in an emergency situation. Today we're going to talk about a lot of topics on how to save life in emergency situations in our homes. If you receive a cut, what you're supposed to do to stop the bleeding? Well, let's talk about this at the moment. If you get a cut by a blade, a sharp blade, or by a knife, you just have to apply pressure on the cut surface on your skin, whether on the hand or on the leg. You just find a very clean towel or clean handkerchief or any clean material, and then you tie it at the place that is cut, and this will stop the bleeding after continuous application of the pressure on the surface. And also, if your hand gets swollen, what you're supposed to do, you just have to put a towel in a warm water, you squeeze it, you apply it on the surface that is swollen. You do it in a continuous manner. When you're not feeling the heat, you put the towel in the water again, you squeeze, and then you put it on the swollen surface. With this continuous initiation of this, the swollen surface will start subsiding. And now we're also going to talk about food poisoning. How do you know you've been poisoned? How do you know somebody put a poison in your food or in your drink? These are the signs to look out for. You'll be going to toilet several times within a space of an hour. You can go to the loo for not less than 10 times. And anytime you go to the toilet, you'll see that there'll be bloody stool, and you'll be having a lot of pain in your tummy. You'll be having a lot of pain on your chest, that's the left chest where your heart is, and you'll be having severe headache too. Anytime you observe something like this too, you have to know that you've been poisoned. So there's a lot of things that you have to do to stop this poisoning, so you don't die before emergency services arrive. You just have to take an onion, one full onion, you peel the skin and you eat it raw. After you eat it raw, all the effect of the poison will subside and disappear in your system within a space of a maximum of 30 minutes. This is something that has been practiced on a lot of people, and they benefited from it a lot. And also, when it comes to management of shock, if somebody collapses, what you're supposed to do, just have to lie the person at the back, and you elevate the legs at an angle of 45 degrees on pillows, and you elevate the head part to an angle of 45 degrees, and then after you give cardiopulmonary resuscitation, and as you do this, the person will come back to life. And also, when a person collapses in public places, you just have to you sit the person, and you check the conjunctiva to see that there is no shortage of blood in the body. How are you going to recognize this? You see that the conjunctiva is very pale instead of being reddish. That is a sign that the person is anemic, and as a result, there was a reduction of blood carrying glucose to the brain, hence leading to the shock. So in such a situation, you just have to find a drink, a sugary drink, and give to the person. The person will come back to normal level of consciousness. And now we're going to also talk about management of we're going to talk about management of fracture in an emergency situation where there is no professional service nearby. If a person has a fractured hand or fractured leg, you have to make sure there is not massive mobility of the hand or the leg. You find a flat wooden board and you put the hand or the broken leg slowly on the flat surface board, and you splint with an elastic bandage in order to reduce pain as you wait for emergency services to arrive. And how do you treat snake bite? If you get a snake bite, how are you going to treat it so you don't die before emergency situation services arrive? You only just have to make sure that the snake bites, the strings and the pain that come from the snake that's in the skin are removed, and then immediately you administer anti-snake venom. The anti-snake venom will prevent the place from getting swollen, and it will also detoxify the snake bite effect on the body so that the person do not die. And also when it comes to management of poisoning in the house, we have to make sure that any kind of substances that look like a drink that is exposed to children are locked in boxes, and there should also be first aid boxes in the house so that in terms of emergency situation we can reach out for the first aid box in managing any emergency situation. And these are the components that are supposed to be provided in the first aid boxes. You need to have elastic bandage, you need to have antiseptic lotions, you need to have analgesics, you need to have first aid manual, you need to also have a thermometer, you need to have other things too that need to be in the box, like scissors. Then also you need to also have tubes, you need to have splints, you need to have ibuprofen, you need to have mouthpieces for administering CPR, and then you need to also have non-latex gloves, and then alcohol swabs. All this should be in the first aid box so that in case of emergencies you can reach out to them in managing any situation that need to be administered to save life. Now we're going to talk about how to avoid death and bring a person back to consciousness after a person is drawn in the ocean or in the swimming pool. In such a situation, you just bring the person out to the surface from the swimming pool or from the ocean, and you make sure you lie the person flat on the surface, not at the back, but on the face facing the ground, the chest facing the ground, and then you turn the head to the left side or to the right side as you compress the back so that any kind of accumulation of water in the abdomen will be coming out. Once the water comes out, you allow the person to continue to lie flat so that respiration will be restored. And also, how do you save a person that has been choked? In such a situation, you have to slap the back. You slap the back several times as you lay the person on your lap. You slap the back, or as you stand behind the person, you slap the back several times. As you slap the back several times, any kind of particles that have been obstructing the respiratory passage or the esophagus will come out. If it's not working, then you turn the person and then you compress the chest, you slap the chest and compress the chest several times, and the kind of particle that is blocking the airway will be removed, and in such a situation you save the person's life. And there was a situation too back in the days when I was working in the hospital, which can also be applied anywhere. There was a patient, an RTA patient, that was declared dead, and I brought this person back to life. How did you do? How did I do it? I elevated. I gave an order for the student nurses around to elevate the foot end of the bed, and also to elevate the head end of the patient at an angle of 45 degrees, and then I passed the cannula immediately and ordered for full blood count, specifically the HB hemoglobin, to rule out internal bleeding. And then after I passed the cannula, I set up infusion normal saline. Normal saline is a form of infusion that contains salt and water by a sterile way. And what's the purpose of this? In management of shock, salt is very necessary for strengthening the ventricular muscles for the heart to become strong and beat nicely. So after giving 1 liter of normal saline to the patient, within a space of 20 minutes, immediately the patient came back to life. This can also be applied anywhere in the world, whether on public places, in our homes. And ladies and gentlemen, thank you for your time. This is Active. We'll be back with you once again. Bye.